Sponsored by rxcardclub.com. Get a free prescription drug card and save up to 85% on prescription drugs. rxcardclub.com. An overview of lung abscess. A lung abscess is a pus-filled cavity in the lungs caused by an infection, usually from bacteria but sometimes by fungi or parasites. A lung abscess can be serious if left untreated, leading to complications such as bleeding in the lungs or a stroke. /r/n/r/n Sometimes called a pulmonary abscess, a lung abscess may be caused by lung diseases like pneumonia or COVID-19. It can be diagnosed with imaging studies of the chest. A lung abscess can be cured with antibiotics, but drainage or surgery may be needed. /r/n/r/n This article presents lung abscess symptoms and causes, as well as how a lung abscess is diagnosed. It discusses how a lung abscess is treated and what the long-term outlook is for people diagnosed with a lung abscess. /r/n/r/n Illustration by Ellen Lindner for Verywell Health /r/n/r/n The symptoms of a lung abscess may worsen rapidly, or they can come on slowly and insidiously. /r/n/r/n Abscesses are described as /r/n/r/n Early signs and symptoms may include /r/n/r/n Later signs and symptoms may include /r/n/r/n If a lung abscess persists or if the diagnosis is delayed, complications may occur. /r/n/r/n Complications of an untreated lung abscess can include /r/n/r/n Lung abscesses may be primary or secondary. A primary lung abscess develops in a region of pneumonia or another lung disease. A secondary lung abscess occurs when an infection from another region of the body spreads to the lungs. /r/n/r/n Abscesses can be single or multiple. Multiple abscesses tend to occur with pneumonia or due to sepsis. /r/n/r/n Some conditions that directly affect the lungs may predispose to a lung abscess. /r/n/r/n A secondary lung abscess may occur when an infection from another area of the body spreads to the lungs. This can occur by inhalation, aspiration, through the bloodstream, or from outside the body, such as with penetrating trauma. /r/n/r/n Causes of secondary lung abscess include /r/n/r/n Risk factors for a lung abscess include /r/n/r/n Alcohol misuse is the most common risk factor for lung abscess. It leads to aspiration, the most common cause of a lung abscess. This leads to tissue death in 7 to 14 days. /r/n/r/n Lung abscesses most often contain a combination of both aerobic, bacteria that live in oxygen, and anaerobic bacteria, with an average of 6 or 7 different species present. /r/n/r/n The type of bacteria present varies depending on the underlying cause, whether the infection begins in the community or the hospital setting, and geography. /r/n/r/n Anaerobic bacteria are usually most predominant and can include /r/n/r/n Aerobic bacteria are also commonly present, especially in people who are immunocompromised. /r/n/r/n These may include /r/n/r/n Parasites /r/n/r/n Fungi /r/n/r/n The types of bacteria found in an abscess are associated with the underlying cause and risk factors. /r/n/r/n For example, /r/n/r/n In the past, anaerobes were the predominant bacteria present in community-acquired abscesses, developed outside of the hospital, with Streptococcus following as the second most common cause. /r/n/r/n This appears to be changing, and now Klebsiella is commonly found in community-acquired abscesses. Klebsiella is associated with underlying diabetes. /r/n/r/n A lung abscess may be suspected based on symptoms and risk factors, as well as physical findings. /r/n/r/n On physical exam, a fever is common. Your healthcare professional may hear bronchial breath sounds and the area overlying an abscess may sound dull when the chest is tapped. This is described as dullness to percussion. /r/n/r/n early on, a chest X-ray may show infiltrates, evidence of pneumonia, without an obvious sepsis present. Chest computerized tomography, CT, is the most reliable test, and an ultrasound of the lungs may be helpful in evaluating an abscess, especially in children. CT is also helpful in distinguishing between a lung abscess and empyema. /r/n/r/n Some imaging changes associated with a lung abscess, /r/n/r/n A sputum sample of coughed up phlegm, is sometimes taken but tends to be inaccurate. /r/n/r/n Blood cultures are often negative when anaerobes are the predominant type of bacteria present because these organisms can take longer to grow in the blood. /r/n/r/n An important first step in evaluating a lung abscess is to distinguish an abscess from an empyema, though an empyema may occur as a complication of an abscess. On imaging, a lung abscess appears as a round cavity inside the lungs, whereas an empyema is located in the pleural space, outside the lungs or between the lungs and chest wall. /r/n/r/n There are a number of conditions other than abscesses that may cause cavitation in the lungs. /r/n/r/n Some of these include /r/n/r/n Antibiotics alone are often sufficient in treating a lung abscess and are effective roughly 80% of the time. Drainage or surgery is seldom needed for the treatment of lung abscesses. /r/n/r/n Drainage is the preferred method of treatment for abscesses in many other regions of the body. /r/n/r/n A combination of broad-spectrum antibiotics is most often used to treat the variety of bacteria present. Antibiotics are often started intravenously and continued for 4 weeks to 6 weeks or until evidence of the abscess is no longer seen on imaging studies. /r/n/r/n With abscesses due to fungi and parasites, as well as infections with Mycobacterium, actinomyces, or Nocardia, a longer duration of treatment may be needed, possibly up to 6 months. /r/n/r/n If the abscess doesn't improve with antibiotics, other treatments may be needed. /r/n/r/n Lung physiotherapy and postural drainage are frequently helpful and often are combined with antibiotic treatment. /r/n/r/n If a lung abscess doesn't respond to antibiotic therapy, less than 10% of cases, drainage may be needed. This is usually considered if no improvement is noted after 10 to 14 days of antibiotics. /r/n/r/n Drainage may either be done via a needle inserted through the chest wall into the abscess, percutaneous drainage, or via bronchoscopy and endobronchial ultrasound, endobronchial drainage. Endobronchial drainage may be considered a better option for abscesses that are centrally located and away from the pleura when there is a risk of puncturing lung tissue, but percutaneous drainage is done more often. /r/n/r/n In very rare cases, surgery may be required. The most common procedures are a lumpectomy or segmentectomy, in which the abscesses and some surrounding tissue are removed. This can often be done with minimally invasive surgery, video-assisted thoracoscopic surgery, or VATS. /r/n/r/n Indications for surgery may include /r/n/r/n With timely antibiotic treatment, the prognosis of a lung abscess often depends on the underlying cause, and many lung abscesses resolve without any long-term problems. /r/n/r/n Prompt recognition and treatment of a lung abscess are important for reducing the risk of complications. /r/n/r/n As with many conditions, prevention is key. Good dental hygiene, prompt medical attention for suspected pneumonia, careful management of blood sugars if you have diabetes, and airway management can help reduce your risk. /r/n/r/n A lung abscess is a pus-filled area in the lungs caused by an infection or by parasite exposure. It's most often caused by aspirating food or secretions into the lungs, with alcohol use disorder a common risk factor. Most symptoms are respiratory in nature, such as a cough or pain when breathing. /R/N/R/N diagnosis typically includes chest imaging and testing of sputum samples. Antibiotics can treat a lung abscess effectively in about 80% of cases, with drainage or surgery rarely needed. With treatment, most people will recover from a lung abscess. /R/N/R/N, rxcardclub.com. Get a free prescription drug card and save up to 80% on prescription drugs.